Media folks ready? Awesome. All right, well, thank you everybody for joining us. Over the recent months, we've made significant progress on improving access to health care to make life easier for Newfoundlanders and Labradorians. This includes initiatives and ideas such as Heart Force One, which is flying people from rural areas to St. John's to get cardiac cath procedures sooner than expected. 85 patients have benefited since the start of this program. Our traveling orthopedic teams are allowing people to get knee and hip replacements sooner than expected, meaning hundreds of additional surgeries a year. The majority of these benefit seniors. We have 19 family care teams. 14 of these are now rostering patients. During the same time, we've also taken other significant steps to improve the health care and quality of life for seniors. We've launched a review of the long-term care homes and personal care homes to help identify opportunities to improve the quality of care and the quality of life for residents, as well as improve the quality of work life for staff. We began covering the cost of drivers' medicals for seniors 75 years of age and older, with physicians billing MCP directly for this service instead of charging patients. We've increased the denture budget and the maximum payable amounts for dentures under the adult dental program. We've increased rates provided for government-subsidized beds in personal care homes and community care homes, which support operators to accept more residents who require higher levels of care. We've worked with the Alzheimer's Society of Newfoundland and Labrador to develop 2 new programs that benefit individuals living with dementia and their care partners. We've increased the number of out-of-hospital cataract surgeries benefiting primarily our senior population. We've also introduced a dementia care action plan with 36 recommendations to increase awareness and improve services for those living with dementia and their care partners. Increased funding for home support agencies. And we know that these are all helpful steps to improving care for older adults. But we know that we can do more, and we will do more. Today, we're excited to discuss another action which will improve access to health care and make things better for seniors in the province. We recognize that we have a high percentage of seniors, and that number is growing. It should come as no surprise that older adults visit emergency departments more often than non-seniors, have higher use of medications, and often suffer from complex social and physical challenges. So I'm excited to announce today that the Provincial Government is creating Centres of Excellence in Aging. These will lead to improved access to quality care for seniors in Newfoundland and Labrador. These Centres of Excellence will be connected to our family care teams and other hospitals as part of the continuum of care. We are establishing Centres of Excellence for seniors because it is common sense to do so, to improve seniors' care in this province. We've heard stories and anecdotes of experiences, often difficult experiences, seniors sometimes have visiting and navigating emergency departments. Establishing Centres of Excellence for seniors will lead to improved access to quality health care for our seniors. For example, the Centres of Excellence will consist of senior-friendly emergency departments, acute care of elderly units, restorative care, and rehabilitative care for older adults. The new hospital that will replace St. Clair's Mercy Hospital and the new, the new Western Memorial Regional Hospital will be centres of excellence. The new emergency department at the Health Sciences Centre will be senior friendly. And while we're waiting for the new St. Clair's, we will have staff trained in the care of the elderly. We are able to provide details on the centres of excellence for the Avalon and Western region of the province because of the previously announced infrastructure projects. The new West Coast Hospital is nearing construction completion and will open to the public in 2024. Work is in progress on the senior-friendly environment as part of the emergency department rejuvenation at the Health Sciences Complex. Planning is continuing for the Centre of Excellence in Central Newfoundland and Labrador, as well as programming for the Labrador-Grenfell Zone. The Centre of Excellence in Seniors, including senior-friendly emergency departments, will consist of training for physicians. The Health Accord also calls for increased training for nurse practitioners in the care of the elderly. Orientation will be provided to other health professionals in the proper policies, procedures, and processes for assessing and caring for our senior population. Standardized screening for older adults, better physical environments, equipment and supplies that are designed to make the emergency visit as comfortable as possible. Attention to appropriate use of prescriptions through medication review. The Centre of Excellence in Seniors will also include a greater involvement of family and loved ones in the care of older adults. As I've noted, the senior-friendly emergency department environment will also be part of the new hospital to replace St. Clair's Mercy Hospital. So we're excited to announce today some more news on the new hospital to replace St. Clair's Mercy Hospital. More than 90 beds will be included as part of the new hospital for acute care of the elderly, commonly known as ACE units, restorative care, and rehabilitation. This was recommended by the Northeast Avalon Healthcare Infrastructure Committee and Deloitte, which is reviewing and assessing healthcare infrastructure needs on the Northeast Avalon. More details on its location and size are still being determined. Planning ahead will ensure that we have more highly trained physicians. It is also to ensure that medical staff working in acute care and senior-friendly emergency departments and centres of excellence are properly orientated to provide that improved care for our seniors. We continue to recruit, which has led to more than 40 physicians starting with our Provincial Health Authority and more than 300 nurses joining the system since April 1st. We are also excited to announce today approximately $5 million in funding for a new geriatric medicine training program and expansion of Memorial University's care of the elderly training program for family physicians. Currently, physicians must leave the province to receive training as a geriatrician. With this investment, physicians will now be able to receive that training at home here in Newfoundland and Labrador. We will have more geriatricians to provide the care that is required. The new training will provide physicians with additional knowledge and skills needed to provide high-quality care to older adults, which will improve healthcare outcomes, improve quality of life, and help enable seniors to maintain their independence. The new geriatric medicine training program and expansion of the care of the elderly family physician training aligns with the Health Accord, which recommends increased training for providers in older adult care across the healthcare system, including family care teams, acute care, emergency departments, restorative care, assisted living, and long-term care settings. Currently, there are 4 geriatricians practicing in the province. The new geriatric medicine training program will allow us to train people here in Newfoundland and Labrador to get us to or above the Canadian average. There are currently 7 individuals practicing in the province who have completed the care of the elderly training program. And we currently have 4 additional physicians signed up for this training. For example, Dr. Melanie Young from Deer Lake will receive this training, return to Deer Lake, and focus on older adult care. For anyone watching from home, your takeaways today: our regional centres of excellence are being established in Western and Avalon. Planning continues on the Centre of Excellence in Central and programming for Labrador. Centres of Excellence will consist of acute care of the elderly, restorative care, rehabilitative care, and senior-friendly emergency departments connected across the continuum of care, including family care teams and other hospitals. We are adding a new geriatric medicine training program and expanding the care of the elderly family physician training program to help accomplish this and produce more geriatricians right here in Newfoundland and Labrador. I'll now pass it over to Dr. Mercer.
Thank you, Minister. My name is Susan Mercer. I'm the Clinical Chief of Older Adult Care with Newfoundland and Labrador Health Services, and I am a Care of the Elderly trained family physician. I'm the Care of the Elderly Program Director for Memorial University as well. On behalf of Newfoundland and Labrador Health Services, as well as Memorial University, I'm excited to be a part of today's announcement of the establishment of Centres of Excellence in Aging. We have a high percentage of older adults in the province, and that number is only growing. And as a physician, I can confirm that we are seeing older adults in need of more acute care services, on medications that may be causing them harm, with complex social and physical challenges, and in need of a new model of care. This is an exciting day for older adults, their families, and healthcare providers. The emphasis on improving older adult care is an important step in providing the best care possible to our whole population. Currently, as Minister said, internal medicine trained physicians need to leave the province to train in geriatric medicine, and that creates a significant challenge for recruitment and retention of these specialists back to our province. With the provincial government funding of the new creation of a geriatric medicine training program, as well as expansion of the existing Care of the Elderly training program, we can train more physicians specializing in older adult care right here at home. These training programs provide physicians with additional knowledge and skills to provide high-quality care to frail older adults with complex care needs. In turn, that improves the healthcare outcomes, quality of life, and better access to care. These investments will modernize our healthcare system and align us with other jurisdictions across the country. By having more physicians working within older adult care, we can begin to close the gaps in primary care as well as acute care. Not every older adult will need to see a geriatrician, but a Centre of Excellence in Aging will mean collaboration in acute care, the emergency department, in the community with family care teams to support the complex needs of seniors more efficiently and more effectively. Our population is changing, and it's very encouraging to see the investment and transformation of our health system. And as a healthcare professional, I certainly recognize how impactful this will be. I'll hand it over to Dr. Parfrey.
Thanks, Susan. So I'm here as the person who was trying to influence the implementation of the Health Accord. And I just want to reiterate that we are the oldest province in Canada. We have over 20% of our population are over the age of 65. And we are getting older. And this is a healthcare problem that's barreling down the track to us because not only are the healthcare needs of the seniors more complex, but they're way more expensive. So the Health Accord's recommendations had a priority on seniors' care, and it was emphasised that we needed to consider ageing in place, prevention and management of frailty in the community, better use of long-term care facilities and personal care homes, and an acute care sector that was sensitive to the needs of older people that are quite different from the general population, hence the specialty geriatrics. And the thought process here was that there would be a continuum from the community to the long-term care sector to the acute care sector. And the recommendation for a Centre of Excellence in Aging was driven really by the belief that if we had a centre of excellence in ageing in 3 parts of the province, that not only would they in those places, in those regional hospitals, provide specialised acute care of the elderly, restorative care to people who have come into hospital, got more frail, required the appropriate restorative resources to allow them to get back out of hospital to their homes, and that they also needed rehabilitation care. And married with those 3 major programs was the concept or demand that we needed age-friendly emergency rooms. So, and on top of the need for acute care responses to our growing number of frail elderly people in the population, we also needed to ensure that these principles of geriatrics care or of seniors care, which is quite different from the general population, I would repeat, that it gets that these people would, and this centre would influence what happens in the other hospitals, what would happen in the community, and what would happen in family care teams, with the objective being that there was going to be a focus on the prevention of frailty and the management of frailty, and a restoration of strength in those people whose frailty has been damaged by being in hospital. So this vision is, as I've said before, it's trying to weave together the idea that it's a continuum and that action is required not only in the acute care sector, but also in the long-term care sector and in the community.
Thank you, Pat. Certainly open to questions from the media.
So when all of this is fully implemented and a senior goes to, say, the hospital and for any sort of an issue, what will this look like in practice for them? How will this look?
I think 3 of us can provide some answer to that, but physicians with greater training in the care of the elderly, nurse practitioners with greater training in the care of the elderly, the Centres of Excellence will provide training itself to other healthcare professionals. There will be orientation for other health professionals on the policies, practices and procedures in senior care. Physically, you'll see things like railings that are in colour contrast to floors and walls, doorways that are in colour contrast to walls in areas where people use doorways, in areas where it's used by staff, they may be the same colour. You'll see rooms that are able to accommodate loved ones to sleep in the room with the patient, for example. You'll see medication more thoroughly reviewed. The continuum of care, transitioning from different levels of care. Health providers will work with individuals to ensure that they transition from one level of care to another, understanding the needs of the individual. For example, rest areas in hallways, no long hallways, clear visibility from the bed to washrooms, and proper lighting at night to help prevent falls. So a number of areas where the senior is in mind, both in terms of the physical look of the unit as well as the training required for individuals. And I'll pass it over, I guess, to Dr. Mercer and then Pat to expand on that.
Thanks. Yeah, I'll probably just add that it's a multidisciplinary approach for frail older adults, so it's a team approach. So as important, the physicians, the nurse practitioners, nursing staff who are trained in older adult care, physiotherapy, occupational therapy, recreation in our hospital settings. So it's really about maintaining function so that when people come to our healthcare institutions, that we are not the cause of worsening function in that environment. So maintaining the function that we have and perhaps even improving function when it comes to restorative care and rehabilitative care. So it's about that team approach and understanding that we'll sort of know what will happen when older adults come to the hospital. Their community providers will be able to provide us information about what they looked like before they came to hospital. We'll all be working from the same sort of playbook in a more standardized way.
I can't do better than that.
So, Minister, you said, you know, it's obvious why we're doing this, but Newfoundland and Labrador having an aging population isn't something that's new. So do you want to talk about why now?
Why not now? We have an aging population. We need more geriatricians. We need more physicians trained in the care of the elderly. You know, I think the shortage of healthcare professionals globally has certainly put a light on the need for healthcare professionals that are trained and better equipped to deal with aging individuals. And quite frankly, one of the authors of the Health Accord is sitting next to me, and this is a recommendation of the Health Accord.
I guess my question is why not before now looking into some of these senior supports?
Well, I mean, we can't change the past, but we can certainly change the future. You know, putting these measures in place will create a better future for our aging population.
I'd just like to add that I think that it's really important to realise that the provincial government and the NL Health Services has made seniors care a priority because it's so important.
What's the timeline in terms of when people can see these centres of excellence in place?
So the staff at the existing St. Clair's will receive the, you know, physicians and so on will have training and orientation for those staff. The Centre of Excellence itself will come with the new St. Clair's building or the replacement for the St. Clair's Hospital. As we're about to open the Western Memorial Hospital and the new long-term care facility in the Western region, you'll see that sooner than you will on the Northeast Avalon in terms of the Centre of Excellence. But many of the decisions that we've made over the past number of months, I keep talking about how the puzzle pieces fit together to provide a picture. The changes we've made in terms of the long-term care review, the personal care review, fit into paving the way for this. You know, the changes in terms of increasing the level of acuity for individuals going into personal care homes fits into this, lowering the reliance on acute care beds by ALC patients. So you've got better flow through, fits into this. The decisions that we've made in terms of enhancing and improving care for seniors over the past number of months fits into this. So all of the decisions are with a vision in mind, and this is the next piece of the puzzle that fits into creating that picture of a better healthcare system. You know, so it is really a plan, and it's based on the Health Accord.
I might add to that really in terms of this is a challenge of integrating multiple different resources to deal with a complicated problem. And that complicated problem is going to happen to all of us as we come to the ends of our lives. We become more frail. And the services that are required for us as that happens are not actually really doctors. They're much more around allied health professionals and how the community responds. So our capacity to have interventions in the community through family care teams to prevent frailty and manage frailty is a challenge because we've got to get these family care teams up and running and working. Then our capacity to introduce all that stuff that's necessary in the acute care sector, the acute care of the elderly units, restorative care, rehabilitation care, age-friendly emergency rooms, that's going to require personnel that are some doctors, but many more allied health professionals to be available in those places to be able to deliver that care. That takes time. So that integration is going to happen over a number of years.
Right, so is it accurate to say that this is a plan and that there's no set date to have all of this in place? It's more of like an incremental approach in the coming years, as you say?
Yes and no. I mean, there is a set time in terms of, you know, increasing the training for existing physicians. That's happening now. The training for geriatrics will be in place within the next 2 years, so there is a set time for that. the replacement for St. Clair's Hospital, when that was announced, it was announced based on some of the recommendations of the Health Accord, including a Centre of Excellence. We can't possibly put a Centre of Excellence for aging in the existing St. Clair's. So when we announced the St. Clair's replacement, we knew that it would include a Centre of Excellence. So the plan is evolving, and the announcements that we're making and the improvements that we're making are all interconnected. But the Centre of Excellence will happen in Corner Brook sooner because of the infrastructure announcements. The Centre of Excellence in St. John's will happen with the infrastructure replacement. We're still looking at Central and Labrador, for example. But the Health Accord is a 10-year transition. We're a year and a half into that, and this is a significant step forward.
So for Central and Labrador, is more built infrastructure needed? Like, does the province need to build up its infrastructure in order to make this happen in those areas?
So for Labrador, and I think, both Dr. Mercer and Dr. Parfrey can speak to this as well, but in Labrador, based on the size of the population, we will use existing infrastructure. The family care teams, which we are building in Labrador, and they will be interconnected with the Centre of Excellence, or the 3 centres of excellence on the island. Dr. Parfrey?
I think that's true, right? These centres of excellence are meant to be outreach to all the seniors that are in the province that are exposed to varying levels of frailty. And I think that the issue in Central is that a plan needs to be developed and the resources provided to be able to make that happen, and the intent of the government is to do that.
And Dr. Mercer?
Yeah, I'll just add that I think that sort of incremental approach is probably what we're going to see as some of the services come together at different stages, depending on readiness and where we're starting from. So we've been working towards some of these services at St. Clair's, for example, for close on 10 years now. So that's a different starting point than other areas where we have to start recruiting and building up services from scratch. So I think that's why you'll see a little bit of that, different levels of readiness and incremental approach. And then as well, just to add is that, when we talk about the centers of excellence, much more important than sort of brick and mortar infrastructure is that human resource, the training, the care pathways. So those things need to be in place, and that interconnectedness between the different parts of the system across the care continuum and understanding, best practices in caring for frail older adults. Those things in my mind are much more important than the brick and mortar kind of structure of a center of excellence. It's the vision of the larger center of excellence across the care continuum.
Minister, the premiers are meeting right now in Halifax for a healthcare summit. A big topic is around intra-provincial recruitment. And I know that the minister, the premier for Nova Scotia said that he would like that practice to end. So what is your thoughts on that? Is that something that the province would, stop doing here, recruiting from other provinces?
Well, we spoke out recently about a recruitment mission from another province. Passive recruitment, I think, is acceptable by all provinces. When the ministers met just recently in Prince Edward Island, we'd talked about this very topic. And passive recruitment is acceptable. You advertise what your incentives are. There may be somebody from Newfoundland and Labrador living in another province who want to come home, and the incentive is just enough to help, with that transition from somewhere else. But that's passive. On the ground, ambitious, aggressive recruitment is something that I don't think any of the provinces really want to see. And so that was sort of the message that we had sent just recently, that, we shouldn't be doing that interprovincially. The passive is acceptable, but not the more aggressive and focused recruitment efforts.
Dr. Mercer, you see firsthand in your role the challenges that seniors face in terms of access to their care. What sort of difference do you see this plan making for them?
All the difference. It's really about the fact that we are seeing more complexity, and I'm trained in care of the elderly. I speak to family physicians out there in the community who are telling me this. So there are, multiple things that are happening at the same time. Changes in fee-for-service family practice, moving more towards blended capitation, for example, will also provide, some opportunities for better care of complex older adults in the traditional primary care settings. The family care teams obviously will really allow for that multidisciplinary care, and that's really what older adult care should be, is that multidisciplinary team-based care. Physicians only have, one part to play, but the other allied health professionals are so important in best practice older adult care. So, as this unfolds, we'll likely see that, we're providing the same type of care in the community. And then when people come to hospital, we know what they can expect from our care teams in the hospital. If they need to get admitted to hospital, we'll see a better workforce that's trained in older adult care and, better suited or better able to meet the care needs of these complex older adults in the hospital. So for me, this is the way forward for better care for this population, for sure.
I'd just like to add something to it, insofar as as we're coming to the end of our lives, we get frail. And a lot of the things that happen in medicine are in people who are not coming to the end of their lives are about investigating things that might end their lives in 5 or 10 years' time, or managing things. And then on top of that, so the approach is a bit different. And then the fact that you can get 3 or 4 or 5 different types of things happening to you as your body fails, and the opportunity exists to be able to provide more and more drugs, and the capacity for those drugs to interact and affect your well-being is pretty high. So I was a kidney doc, and I was one of those docs that was very active in managing disease, etc. When geriatricians got involved with our patients who were coming to the end of their lives, they were much more hands-off. And they had a much more different approach, that is the correct approach. And our capacity to retrain our system about how we deal with frailty is really important.
Well, thank you, everybody.
Thank you.